Yesterday related to AI. Dr. Tushar Maniar and Dr. Tushar Shah. Dr. Tushar Maniar is Head of Department Pediatrics, Nanavati Max Super Speciality Hospital, Mumbai. He is the Director of Maniar Clinic, Andheri, Mumbai. He is a contributor to Nelson Essentials and Elsevier Point of Care. And please welcome Dr. Tushar Maniar.
Thank you.
Dr. Tushar Shah actually doesn't need any introduction to any of you. So he is MD physician practicing at Advanced Hospital Ville Parle since 1990. He's personally treated nearly 400 indoor COVID patients, and his team of 10 doctors has formally managed over 10,000 COVID cases on OPD basis. He is a poet and humorist, having contested in the finals of Laughter Challenge show on Star One. His interest in teaching has enabled him to form a Telegram group avidly followed by over 2,000 doctors, where he uploads videos and updates regularly. And as we all know, Dr. Tushar says few lines every time, so I have made some few lines for him. Gustaki maaf ho. आया जीपीए का ये रविवार, लेक्चर्स के लिए हम सब है बेकरार, शिक्षा के साथ मनोरंजन की फुहार लेकर आए हैं हमारे प्यारे डॉक्टर तुषार. प्लीज वेलकम डॉक्टर तुषार.
Thank you so much. Thank you, Chairperson ji.
Hello. Good morning, everybody, and welcome to Jamnabai Nursery School. Today, Saraswati Vandana took me back to my kindergarten and my primary days, and it was really heartwarming. What we are planning to do is, we understand that AI is in its primary stage. All of you also are in primary stage, and so are we in the primary stage. So with that background, we'll start today's session. The idea is to sensitize all of you and all of us to start using it so that we don't lag behind. Okay? Hello, hello. Hello.
Volume monitor नहीं है. Monitor को ऐसे ना. Monitor को ऐसे कर देंगे. मेरे लिए.
Tushar, over to you.
All of us use Google as a search engine. All of us use medscape.com or other medical sites for knowledge acquisition. So why do we need AI for knowledge acquisition is the first question that comes to mind. AI and Google search are different in 2 or 3 ways. One difference is that AI can be creative, whereas Google search will tell us sites to go to become or learn creativity. So, for example, if I ask Google, can you write a 4-line poem on senior doctors attending school in the latter half of their lives? So what does Google give me? Google sends me to poetry in medicine, some site, etc., etc. It doesn't write a poem for me, right? But if I ask the same thing to, say, Copilot, it says, some doctors in their senior years decided to go back to school. They wanted to learn new skills and ideas and prove that they were still cool. Now, this poem of 4 lines was written by the AI called Copilot, in about 30 seconds. Now, this is a very simple example of the creativity. It can write a full-length novella, full story. So, it can write an essay on a medical topic that you want to talk about. For example, if somebody wants to talk about investigations to screen for cancers, it will write a full chapter for you, ready-made. So, and then there are some AIs which will make PPT for you on the same. So, there are many ways you can use AI instead of your Google search.
But whenever you want to use AI, I think the most important thing, apart from where to look, is how to look. And that's where the prompt comes into play.
What is a prompt? Prompt is a request for an answer. Remember, these AIs are answering engines, not search engines. They answer your questions, and the beautiful part is it will not stop at one question answer. You can continue the conversation in the same theme for up to 30 questions at least. It's the same theme you can continue. So if you give a prompt to an AI, we'll talk about specific AIs gradually, just introducing you to the concept of prompt. What is the prompt? A patient of rheumatoid arthritis is to be started on tofacitinib, which is an immunosuppressant, as you know. She has positive IGRA test, which is a quantiferon test for latent TB, and the positive test indicates latent tuberculosis. Should I start an immunosuppressive like tofacitinib in this patient of rheumatoid arthritis? What will Google give me? Google give me articles. There is this article called Risk of Tuberculosis Development in Patients with whatever started on tofacitinib. This is an article which is an authentic article, and we can go through this article. But if I ask the same question to a Bing chat or Copilot, what does it give me? I'll read out. Before starting a patient with rheumatoid arthritis on tofacitinib, it is important to address the positive IGRA indicating latent TB. According to CDC guidelines, treatment of latent TB should be initiated before the use of tofacitinib if there is latent TB, and the CDC recommends the following regimens. So this is what specifically AI will give me rather than send me to sites. Now, can you check this? Do you think that this information is authentic, and can you check this? You can easily check this because many AIs will give you references or sources from which they took their information.
So here, if you see number 1 written over here,
this is a reference.
Yeah, so if you see this one, number 1 written over here, then that would be your point to click, and that will take you to the original article or guideline from where the AI has sourced this information. Now, so should we stop using Google at all and search engines at all and go only for Copilot? It's not the case. So just to tell you, suppose I'm searching for guidelines. If you see on the left side, it's a Google search. On the right side, it's an AI search. So if I ask for guidelines for clinical practice, guidelines for acute abdominal pain, Google will give me 4 or 5 good sources like National Institute of Health, American Academy of Family Physicians, BMJ, all these places. So I can go on and get authentic information. Whereas if you see the AI part over here, it will give me a small summary on what guidelines are there. So we must use Google as a search engine for certain things. Say, for example, images, algorithms, guidelines. And when you want to ask any concept-based question or specific question, then we should utilize AI. The good part is, now when you put something on Google, first it will give you a Google search, and there is a small button on the top. If you see, it says generate with AI. So the moment you click generate with AI, at least Google, whatever AI it is using, it will give you some more information on that. And the same works with Bing as well. But as we said, we cannot overemphasize the importance of a good prompt. It's like in a Google search engine, what you put in, you get out. Okay? So same way, it's important to know the right prompt. So suppose you asked, what is the dose of primaquine in falciparum malaria?
I'll just first introduce, as you know, primaquine is a drug for radical cure of vivax malaria. And in falciparum malaria, it is used as a single dose to eradicate gametocytes. So I tried to kind of fool ChatGPT by asking, what is the dose of primaquine in falciparum malaria?
And the answer you get is primaquine is not the primary treatment for uncomplicated falciparum malaria, which is not wrong, but that's not the answer you want. So you may need to fine tune or give your prompt in a better manner. So what did we decide? We said, what is the dose of primaquine to eradicate gametocytes in falciparum malaria? And now you get the appropriate answer saying it is 0.75 milligram of base per kilogram single dose as per WHO.
So here I again asked a third question, which I'm not showing here. In 2015 or 14, the WHO modified the dose to 0.25 milligram single dose. And I asked specifically this source, is there a modified dose of WHO? And it could not give me an answer. So their database is huge, but sometimes incomplete.
So, taking forward on this note, if you see on the on your left-hand corner of the screen, you see ChatGPT 3.5. So that takes up data only from a certain period. That's, I think it's 2022 or 2021. But if you use paid version of ChatGPT 4, or you go to another search engines or AIs like Bing or Copilot, then they already incorporate ChatGPT 4. And so you can get more recent information as well. But if you were to ask, suppose ChatGPT 3.5, what is the weather going to be today in Mumbai? It will say, sorry, I am not capable to answer that, right? So what are the various popular engines that you can go through? So ChatGPT was one of the first one, and that got us all enticed into AI. It is still one of the good ones, and version 3.5 is free for all to use. It's available on mobile as well as on your laptops. Okay, so if you ask a question, if is India facing a shortage of primary care physicians, it will give you various things. Now you can use it for medical as well as non-medical. If you want references also to happen with the content which has been delivered to you, you can use either Bing, or you can use what we all feel very happy about is Perplexity. So Perplexity, when it gives you the AI summary, there are references which are there on the bottom. So you don't have to go and search the authenticity. You can verify the content which has been provided by the AI. If you notice, in last 10 minutes, we must have said verify, I think 5 times. And that's what we'll emphasize further. Tushar.
So if you see, this is Perplexity. How many of you have used Perplexity? A few of you. How many have used ChatGPT? All of the same who use Perplexity. How many of you think Perplexity is better than ChatGPT? A few of you. Now, why is Perplexity better? One is, Perplexity not only is an answering engine, it gives you answers, but it gives you good references. Especially for medicine, it is important for us to know the source of the material that it gives. So I have asked a question, name 3 causes of motor dysphagia. The answer is below, which I am not showing you. I am showing you the sources. So it will give anything from 4 sources to multiple sources, and it tells you where it is coming from: National Institute of Health, Mayo Clinic, etc. Now, agreed that not all the sources are great sources in the sense that I would rather have guidelines as sources, international guidelines as sources. But these are good enough sources, and from there you will get more sources. So that is the good thing about Perplexity. Also, Perplexity is free. If you pay $20 per month, it comes with what is called as Copilot. If you see right bottom, Copilot. Basically, Copilot is an app which uses ChatGPT latest version called ChatGPT 4. So that has more capabilities. So currently it is using 3.5. Perplexity is in a development stage. It has just received a large amount of finance from Jeff Bezos, and I think it will become an even better engine that we have right now. Having said that, as he said, ChatGPT 4, if you can pay for it, which is again $20 a month, you probably can get very, very good answers and results.
And what is the importance of knowing the references? It's not just to verify what has been said, but also many times you want to read more about it or have details, explanations, and data which has been supported, which it is being supported with. Also, it's important to, when you create your login, if there is a profile to be created, if you say that I am Dr. Tushar Shah, don't say I am Dr. Tushar Shah. If you say Dr. Tushar Shah and say physician, and when you ask a question and say that you also assume the role of a physician, it will give you much better answers than a layperson. Because if you see here, the references which has been put up, some of them, if Mayo Clinic looks very interesting and authentic, when you click it, it will give you patient information, meaning what is there for the patient, that information will be given to you. If you have logged in as a doctor, you will get slightly higher level of professional information.
So we have spoken about Chat GPT, which is an AI available as an app also, and or you can go on the web and go to the website also. Remember this, if you use any AI on your laptop, the features are somewhat different in some ways than if you use it on your mobile. So there might be some compromises on the mobile phone, but apps are available for most of these. So first of all, we are talking about three principal AI answering engines. One is ChatGPT, the other is Perplexity, and this is the third called Bing Chat. Bing, as you know, is a Microsoft's version of Google search, meaning Bing is a competitor of Google. Bing Chat was an app created by Bing as an AI app. This has now been renamed to Copilot. This Copilot is now a standalone app. This is, of course, the word Copilot, as you saw, was also used by Perplexity, so we don't get confused with it. But Copilot is now a standalone app available for both iPhone users and Android users. Copilot is probably currently the most advanced answering engine that we have. It uses free ChatGPT version 4. It is incorporated, the ChatGPT 4 is incorporated. Soon it will become paid, I think. Currently it is free. Yeah, can we see an example?
So, as I said earlier, when you use Google search and then you can click generate AI, if you are using Internet Explorer as your search, as a browser, thank you. As a browser, if you have a button on Copilot, so you can put it like a routine search, it will search through Bing. When you press Copilot, it will give you the AI answers. So now life is going to become easier to use or switch between the two. There are many other interesting uses of that, and he'll emphasize.
So as you see that on Copilot, you can have image creator. Image creator means you can make paintings, you can make drawings, you can do photographs of whatever you want. So you have to just give a prompt. What is the prompt that I gave? I had Dr. Bhargav or Dr. Sunitha Manglik in mind when I gave the prompt. 55-year-old female Indian physicians of thin build, medium height, black hair, bespectacled, in a sari, with a smile, standing on a stage with a screen behind her showing a medical slide. This is all I had to write, right? And they usually give 4 images. I have shown you 2. So these are 2 images. I don't know who is more familiar, kind of looks like who, but they give very beautiful images, which is very lifelike images that you'll get. These images are for masti karne ke liye bhi hai, time pass karne ke liye bhi hai, but more importantly, you can use such prompts to create images which you will use in your conference slides, and it makes your slide, the presentation more colorful. Right?
So now let's pay attention to the most important thing, that's the prompt. So we have created this prompt which says, assume a role of expert pediatric rheumatologist, give scientific evidence-based answer. We have a 10-year-old girl with fever for 1 month, oral ulcers, sorry for the typo, and a skin rash. Please give likely differential diagnosis. So if you see here, the first prompt is to tell the AI what role AI is supposed to undertake. So the answer should come as an expert pediatric rheumatologist and not as a layperson. Second, I want precise answers. So when you go on to Bing, there are 3 buttons: creative, basic, and precise. So if you want something, what we showed you earlier in the image point, you can use the creative. But if you want a medical answer which is specific case-based, then you can use precise. That way you will get more appropriate information. So when we give a prompt, we are saying that ask them always start your prompt by saying what role the AI should be taking. Be specific and give inputs. So suppose you asked for monsoon-related illnesses. If you wrote India as well or Southeast Asia, it will make sure that it will include dengue. But otherwise, it may not include. Also describe the goal. Now this is very important, especially if you are creating any academic content. Suppose you are preparing some questions. You want to tell them these are for undergraduates, postgraduates, exit level exams, etc. There are other uses of AI which I think as we use it, you'll know. You can summarize a big article and you can tell the AI how many lines you want the summary in. And so you can put a title of the article or the link in some of the AI, or you can just simply copy paste the article. The problem is they have a word limit. So if it's a very large article, you will have to go to the appropriate AI. Translation part, we will be talking about it and hopefully we'll give you a live demonstration on how we can use it. And of course, it's good to ask open-ended questions to start with and then start conversing with the AI, which also we will show you in next few slides. As in you ask one question which is broad and then you keep asking more details about the same.
Can we open the thing for the audience for some, to break the monotony? Any questions so far, or anybody who thinks that we are wasting your time? Yes, sir. Yeah, this is a dangerous tool in the hands of a layperson. Imagine a layperson asking the dose. I'll show you a layperson's question in the next. It is going to be very difficult, and this is something that we will have to kind of deal with. And we are dealing with the Google search doctors. And yeah, agreed. This will become more and more difficult.
Yeah, the more difficult part here is going to be that it will tell the layperson can also assume the role of a senior physician, senior cardiologist, which many of us have struggled to.
Somebody else wanted to ask questions, sir. No, sir, sorry, $20 per month. I'm so sorry, I didn't say that. $20 per month, or you can make an annual payment of an equivalent amount, approximately. So the lagbhag 2,000 rupiah per month.
But nobody should be dissuaded by that. I think most of us, for 95% of our work, we can do through Bing Copilot or with ChatGPT 3.5.
Yes, ma'am. What are the legal implications? So you're not using this for prescribing. In fact, you're using WhatsApp for prescribing, which may have some legal implications. But you're not going to use ChatGPT for prescribing. If it gives you wrong information and you use that wrong information to treat the patient, then you are the person who's going to be implicated. But but that can happen. So we'll also show you some things there.
Yeah. So what are we saying? We say AI assistant, right? The term used is assistant. So you can never put the blame on AI. Responsibility always lies with you, and that is why we keep saying word verify, and again verify.
Ma'am, you wanted to... Yeah, she's asking a very interesting question. Google search, what is the source of information? ChatGPT, what is the source of information? ChatGPT's source of information is everything that exists on the internet. Everything. Meaning if you write a blog, that blog is in as a source of information. Now, when you ask Google, kindly search this, how many results does it give? Anybody? Lakhs. It can give lakhs. And how many do you see? You will see first 4 or 5. So what ChatGPT sees is all the lakh results on Google that you have. And then it analyzes those and gives you what it thinks is the answer. Now the funny part is, if she asks one question and you at the same time ask the same question from 2 different apps or 2 mobile phones, your answers will be different in their construction. They may not be different in their authenticity. They may be different in their construction. So that is important to realize. And therefore, yeah, sorry, you were saying something.
Not only that, if you ask a particular query and say regenerate, even then you may get a different answer, right? So it's nothing sacrosanct. For example, Google search, you ask the same question again and again, you will get more or less the same answers. Here you will get different answers.
Also, unfortunately, Google search is now influenced by payments. So if anybody pays Google search, the results can come on top for Google search. Their main source of income is payment. So that is one more bias that Google may have. Dr. Rasalkar? I'll repeat the question. I'm sorry, I will repeat the question that they say. Huh? Okay. I will repeat the question. Huh? What should be normal?
IQ should be normal or above normal. In that when I came home, I talked to him also and said that I had read some books wherein they say that IQ and LD are unrelated. However, he didn't agree for that point. And then I came home and searched AI. In that he says that these two things are totally different. And IQ can be different and LD can be different.
LD is learning
He
disability.
means the IQ agree. I mean AI agreed almost to my opinion. But how do I convince the psychiatrist that the Chat GPT says so and so, but it differs from your opinion?
Can I answer that?
Yeah.
Yes.
Please change the psychiatrist.
So
You are not going to convince any doctor. No, it's not derogatory to that psychiatrist.
No, sir, it's not that way. I wanted a certification which is only available with Cooper.
No, I
and that's
understand.
what
I
I
don't
had
want,
to go.
that's why I'm happy you didn't tell me the name of the person. If it was me also, I would have said the same. Or if you are open enough, you can share that information with that concerned person. He or she can look into it and change the opinion. There's no way whether Google or AI or any textbook can change anybody's opinion.
No, you will have to go to the rule book, if there is a rule book of the BMC or anything. Nobody is going to say, okay, AI बोल रहा है तो मैं ये certificate दे दूंगा. वो नहीं हो सकता है.
No, sir, the point is the psychiatrist says he has read all these years that IQ and LD are related. But that is not the case. I have read another psychiatric book wherein it says that they are two different things.
So maybe in the same department you can approach a senior person, maybe.
Okay, sir, thanks.
Yeah, ma'am.
So we were actually trying to get some good apps for dermatology and for radiology. And remember, AI is evolving and evolving very fast. So there is an app called AYSA, AYSA. It is far from being accurate. So we decided not to include it here. Maybe few months or some time later, we'll have a better idea. A very promising app is being developed by Google and it's called MedPalm 2. So that's going to, when it comes, right now it's in beta version. So when it comes into real life for all of us to use, it will be a game changer.
If you ask us to take the same topic next month, all these will be redundant, archaic, obsolete. All the slides that we have shown you. AI is rapidly developing by the hour, not by the day also. So we will have more and more. But as you said, very useful for ECG reporting, X-ray reporting, eye changes, because eye changes are already being, retina has already been reported.
Histopath.
All radiology, including MRI imaging, everything. Histopathology, big way in the US, they are using histopathology through AI only now. So yeah, it will change.
For you and me, I would say today, you can search the AI or use the AI after you have finished thinking yourself about that situation. So you have got 4 differential diagnoses or 4 different treatment options. You want to run an AI and see, did I miss anything common or useful? So AI will give you 10 points or 8 points and you know that, no, what 4 you thought are still the most important and they are in the order of priority. You can also use it for comparison of things, right?
I'll take one last question there. Okay. The one word that I use to encourage people is tinker. You know what is tinker? Time pass karo. Tinker on AI. Keep on tinkering till you get a hang of it, till you see all the niche ka buttons and click all the niche ka buttons and learn more and more about AI. And the second thing that you can do is, as he said, learn prompting. Prompt engineering has become a huge teaching course. You'll have multiple people trying to make you join their prompt engineering classes. That is nonsense. For us doctors, we have to self-learn. In fact, I'm so glad Dr. Preeti agreed when I said I'll take the AI lecture instead of some professional coming from somewhere, because we doctors know what we want. And I can tell you probably a little better than the geeks from the computer industry to tell us what we want. So I think, yeah, so tinker and learn prompting. I learned prompting this way. I started prompting with one sentence. I got some result. I made that sentence into 2 sentences, got a result, made it into 3 and then 4 and then 5 sentences. The longer the prompt, generally, the better the answer. Yeah, next.
The good part about prompt is you don't have to worry about spell checks. You don't have to worry about grammar. Because if it is smart enough to understand what you're asking, it's smart enough to know what you are writing. So let us give you some demonstration and then we'll ask you to give us a prompt if time permits. So what is converse? Converse, as Dr. Tushar Shah said, we ask one question, then you ask a supplementary question, you ask a correction, or you ask for new information. And everything is related to that topic. So till you keep asking questions, it will understand that you are asking from that particular question. And you don't have to retype the whole thing. And now that you have finished it and you want to ask something else, there is a button which says new topic. You click on new topic and then it will start an independent query. Okay. So let's see this question. We have already seen this prompt. One second. No, maybe that once I go to pointer, it doesn't show display. Okay, assume a role of expert pediatric rheumatologist, give scientific evidence-based answer. We have a 10-year-old girl with fever for 1 month, oral ulcers and a skin rash. Please give likely differential diagnosis, right? So right now I have a patient who is 10-year-old and has these symptoms. We all know we are thinking in terms of some autoimmune condition. So when I run this, it will give me these options. So it has given juvenile idiopathic arthritis, Kawasaki, SLE, Behçet's, and a long list of questions, long list of differential diagnosis in a particular order. Now I'm supplementing it by giving further information. I'm saying that there is, okay, now I'm giving this information, it's highlighted for you. WBC 3000, platelets are 90,000, ESR is high, but CRP is normal, right? So now you see, it has changed its differential diagnosis, and now SLE comes up first. So this is how, once you give first prompt, you will get an answer, then you have given supplemental information. You could have given this information first up also. The problem is if you give that information first up, it would have probably give you only 2 or 3 diagnoses, whereas here you got first 10 diagnosis, differential diagnosis, and then you got this one. Now further, if you see it has given SLE first, and then the JIA and other ones have gone down. Now I am supplementing further by saying that ANA is positive. Which other investigation should be done? So now I am confirming the diagnosis and asking for more investigations, and we have not shown you here, but if you go further down, it will say now this patient needs dsDNA and other renal markers and so on and so forth. Okay, so this is how it is when we converse. You can use this also for comparing what is which is better than the other. So what we have taken here, Dr. Tushar, you want to switch?
Assume that you are a senior cardiologist. That is what we told the bot. And please compare various statins for management of dyslipidemia in a young adult. So this gave us comparisons. It says atorvastatin reduces LDL by more than 50%, rosuvastatin also 50%, simvastatin 30 to 50%, etc. Now it gives this, but did it tell me which dose of atorvastatin is equal to which dose of rosuvastatin? It did not tell me. So if my prompt is better, also give comparative doses of the same for reduction to 50% of LDL. It will give us that. So, yeah.
Yeah. So you can put a next prompt saying that give me equivalence of, suppose you're asking for steroid, and you can say what is the equivalent of hydrocortisone with prednisolone. Or you can ask for comparison which PPI Can you arrange the PPI in the order of its influence on QT prolongation? So suppose some patient has QT prolongation or drugs which are going to cause QT prolongation, whether to use pantoprazole or whether to use omeprazole. If you ask that query, it will tell you probably that omeprazole is safer than pantoprazole, though both can have influence on QT prolongation. So there are many concept-based questions that you can ask, which on Google, it's difficult to get answers for.
Take the next slide.
So this is the new baby on the horizon, and this has been nothing political, but this has been introduced by our Prime Minister Narendra Modi in one of his live talk where he spoke in Hindi and people sitting in the audience could hear it in Tamil or many other languages. So how we can use it over here in our day-to-day practice is what we'll try and demonstrate.
How many of you think that, okay, putting the correct prompt, which is 4-line, 5-line wrong, you will be more comfortable in your native language than you will be comfortable in English? There must be some people here. There must be some people in rural India who will be like, Marathi mein prompt dalenge, Gujarati mein prompt dalenge. Now, ChatGPT does not accept Marathi prompts or Gujarati prompts. So you might supplement that with Bhashani. Bhashani is an app which converts Indian languages and English to each other. It can do English to Gujarati, Marathi to English, Tamil to Marathi, English, Tamil to Marathi, etc. So should I give a demonstration from here, from there? Okay, I'll need a prompt from you. Name some foods that increase acidity. Anybody? Oranges, idli sambar, okay. Abhi recent experience. Huh? Chili, misal, अच्छा local food है. वड़ा पाव, misal, idli ले रहा हूँ अभी तो. Huh? Let us see. Started? Okay. There are many foods which increase acid reflux, means acid comes, that is made in the stomach, goes up into the esophagus, causing heartburn. Some of the foods include idli, vada pav, and misal. Now this is English to Gujarati. I'll read the Gujarati version. Okay, it stopped, the audio stopped in between, I think. I think there is also a James किधर से है? Many other foods, especially Maharashtrian spicy foods from Nagpur, cause a lot of acidity, and this acidity makes patients have burning in the chest. ગુજરાતી says ઇડલી સાંભાર મસાલ અને અન્ય ઘણા ખોરાક ખાસ કરીને નાગપુરના મહારાષ્ટ્રીયન મસાલેદાર ફળો ઘણી એસિડિટીનું કારણ બને છે અને એસિડિટીનો અર્થ છે કે દર્દીઓની છાતીમાં બળતરા કરે છે. સો નાઉ this is funny, but what I'm saying is that if you want to give instructions to a patient in their local language, meaning you want to say avoid these foods because of your GERD, you have to say in English and translate. Now, there is Google Translator for this. But what you can also use is this, because it gives you many languages. Then you have to copy paste, which you can do easily, whichever version you want, put it on your WhatsApp and send it to the patient. Or you can copy, sometimes I go from Bhashani to ChatGPT also and ask them to make corrections in the version of English that has been given by Bhashani.
Also, you can use the share button and go directly to WhatsApp rather than even trying to copy paste it.
Yeah.
Okay. So again, like all of us, Bhashani is also in its nascent stage. And the live version, whether when you start talking, it will translate to the patient, we are not sure. Plus, as you can see, there are still some improvements that you need to do before it can be used without correction. So if you use it live, there is no scope for correction.
So in this, I had said in English और हिंदी में आया कि हम डॉक्टर प्रीति भार्गव की अध्यक्षता में 6 और 7 जनवरी 2024 को जमनाबाई स्कूल में जीपीए सम्मेलन वगैरह. नाउ देयर आर सम हिंदी वर्ड्स विच वी डोंट इवन नो. अध्यक्षता मालूम नहीं होगा तो लिखेंगे कैसे? तो दैट इट गिव्स अस a very authentic language. So I think what I've done in Gujarati, Marathi and Hindi, it gives very accurate answers. आज इतना अच्छा नहीं किया उसने इडली में, लेकिन वो हाँ. ओह अच्छा. क्या बात है यार. सो पैनक्रियास को क्या बोलते हैं मुझे नहीं मालूम, लेकिन लीवर को कलेजा बोलते हैं फॉर एग्जांपल. तो इट विल से कलेजा, इट विल नॉट, बट कभी कभी इट विल गिव द इंग्लिश नेम आल्सो.
Swadupind, correct. Swadupind. At least in Gujarati, that's what it is called. Yeah. Okay. Going on, as we said, we cannot praise anybody beyond a point, so we need to find faults. Otherwise, there is a problem. So this image has been created by Dr. Tushar Shah again on a on a DALL-E on Bing by giving the prompt. Can you just tell us the prompt, Dr. Shah?
The prompt was, show me a robot or a bot which is hallucinating that mosquitoes can be killed by certain antibiotics. That is some kind of prompt, and it made this image.
Like people use for dengue.
Yeah. Basically, AI hallucinations mean that AI can make mistakes. It can hallucinate. जहाँ पे कोई answer है नहीं, it manufactures an answer and gives us the answer.
So here we have asked, what is the dose of doxycycline in leptospirosis in a 6-year-old child? And we get the answer, usual recommended dose for doxycycline is 2 to 4 milligram per kg in 2 divided doses. What is the hallucination here? Brilliant, right? So you don't want to give, preferably not want to use doxycycline below 8 years of age. So that is where you need to be careful what you are asking. Or we'll give you one more example here.
So I asked them, basically I wanted to induce hallucinations, right? I tried many questions, but ChatGPT did not give me many incorrect answers. So I asked, what is the dose of valacyclovir and acyclovir for zoster if both are to be given together? So it hallucinated and it gave me the dose of both to be given together, right? So it will make mistakes, but sometimes you have to really try hard to induce mistakes by
So there are, everything requires everything requires validation. So if you are trying to use a new app, try and do this. First give them to do something, then you give another prompt which is exactly the opposite or which is the reverse. So you say, can this be both to use together? Can this be not used together? Or you say, oh, I think you made a mistake. Why don't you correct it? So it will apologize immediately and tell you that it's my mistake, even though it is not their mistake, right? So that way you can check how good or how proper is the app. Yeah. So before we go to live session where we will ask you to give us question, apart from ChatGPT, this is the popular thing which can happen if you use live translation. I don't know if you can read, but it says you are looking hot as hell, wanna hang out? And it has translated, tum narak ke saman garm lag rahi ho, latakna chahogi? So that's where you have to be careful, and that is why verify keeps coming on and on, right? And lastly, this has become our favorite line lately, used by many of us, and that says AI will not replace physicians, don't worry. However, physicians who use AI may replace those who don't use AI. So with that, we ask you your queries or your prompts, and we will try to do a live session and show you on this.
Sir, let's take just 1 or 2 prompts.
Sure. Any? Yeah. Yeah.
Yes.
Browsing history, it keeps our records. All our chats are on record, and we can go back to the chats. You can ask other questions. We'll not do a demo. Any other questions? We have only 2 minutes now. Yes, sir. There is no direct prescription from you to the patient based on AI. You are taking all responsibility from wherever you gain your knowledge, whether it is Google search, Medscape, it is now your responsibility to prescribe to the patient. Sometimes authentic knowledge will also be challenged by the patient. That will happen, right? But that is something that you'll have to
So
live
if you see here on the right-hand side, you can see the chat history, and I don't mind showing you my chat history, the AI history, that is, what queries we have asked in last few days, and you can keep on going further. And this is what I was emphasizing. If you see in the middle, there are 3 buttons: creative, balanced, and precise. Default is balanced. You want more precise information, please click here to give you precise. And if you see subtle, the background color also changes a bit. Okay, this is more pink and this is slightly on the greenish. Every time you want a new topic, please click on this new topic.
Okay, last 2-3 questions. Yeah, ma'am. You can upload images in Bing, or what is not called Copilot. So she's asking whether we can upload images. So you can upload images, whether it will give an interpretation of an X-ray or an ECG, we still don't know. Yes, sir. You have an angiography report? So if you give the history properly and the angiography report as a written report, maybe not as an image, then it will give you some recommendation, but always with a byline that please consult a cardiologist.
Yeah, one point, sorry. Just one more thing we wanted to share. Another use that I do it regularly in my clinic is to use the translator for with Google Lens. So you'll have a patient who comes, international patient who comes from another country and you don't know how to read the box, or you want to translate your own prescription. If it's a typed prescription, put a Google Lens, say translate from English to French. It will translate into French, take a screenshot and show it to the patient. That's pretty accurate. Yeah, please.
Yeah. So I made an emotional statement saying that I'm feeling very low. What should I do? And it kind of says, go to a suicide helpline. Call a suicide helpline right now. Okay, thank you so much, everybody.
Thank you very much.
Thank you, doctors, for the very much informative talk. I request ex-IMA President Dr. Anil Awad to felicitate Dr. Tushar Shah and senior GPA member who has worked on many responsible posts, Dr. Supriya Patil, to felicitate Dr. Tushar Maniar.
Yes, sir. उन्होंने भी दिया, ठीक है, उनका CV प्रोजेक्ट करो, सोनालिका, मैं एक दो अनाउंसमेंट करूँ तब तक।